Good day and welcome to our training on Emergency Obstetric Care for Prime Care Nursing Practice. By the end of this session, the participants will be able to 1. Describe the major anatomical and physiological changes that occur during pregnancy. 2. Explain how pregnancy affects the cardiovascular, respiratory, renal, endocrine, and hematologic systems. We will start with knowing what anatomy, physiology, and pathophysiology mean in pregnancy. To understand emergencies in pregnancy, a nurse or midwife must first understand 3 connected ideas: anatomy, physiology, and pathophysiology. In simple terms, anatomy is about body structure. Physiology is about normal body function. Pathophysiology is about how normal function becomes disease. In emergency obstetric care, this knowledge helps clinicians answer an important question. Is this finding expected in pregnancy? Or is it a warning sign that something is going wrong? First, let's look at anatomy. Anatomy tells us the structure of the body. It helps us know what body parts are present and where they are found. In pregnancy, anatomy becomes especially important because the uterus enlarges, abdominal organs shift, and body posture changes as the baby grows. Next, we have physiology. Physiology explains how the body normally works. In pregnancy, it helps us understand how the woman's body adapts to support the baby. For example, her blood volume increases, her heart works harder, her breathing changes, and her hormones rise. Finally, there is pathophysiology. Pathophysiology explains what happens when normal body processes become abnormal or begin to fail. This is where disease and emergency begin. For example, a normal increase in blood volume helps support pregnancy, but if the woman bleeds heavily after delivery, that same system may no longer compensate and shock may develop. A nurse who understands normal pregnancy changes is more likely to recognize danger early. Without that understanding, abnormal findings may be missed or mistaken for normal pregnancy discomforts. Now, we will look at how pregnancy affects the cardiovascular and respiratory systems. First, the cardiovascular system. The CVS changes greatly during pregnancy because the mother's body must supply blood not only to her own organs, but also to the placenta and the growing baby. The heart works harder during pregnancy. Blood volume increases by about 40 to 50%. Heart rate also rises and cardiac output increases significantly. Blood pressure may fall slightly during mid-pregnancy and return closer to normal later. These changes are normal and helpful, but they also affect emergency assessment. A pregnant woman may lose a large amount of blood before her blood pressure falls noticeably. This means shock may be hidden at first. Instead of waiting for obvious hypotension, the clinician should pay attention to early clues such as fast pulse, restlessness, pale skin, weakness, and poor perfusion. Next, we will look at the respiratory system. As the uterus grows, it pushes the diaphragm upward. Tidal volume increases, and oxygen demand rises because the mother is supporting both herself and the fetus. Many pregnant women breathe more deeply and may become breathless more easily. This becomes especially important in emergencies because pregnant women may have less reserve during respiratory distress and may deteriorate more quickly if breathing becomes difficult. Here is an important note to remember. A pregnant woman can look fairly stable, while serious cardiovascular or respiratory compromise is already developing. Early recognition matters. We have come to the end of this session. In summary, we established that understanding anatomy, physiology, and pathophysiology is the key to distinguishing normal pregnancy changes from life-threatening warning signs. We explained how the body's cardiovascular adaptations can actually mask the signs of shock, making early clues like pulse and skin tone more important than blood pressure alone. We concluded that because the respiratory system works harder with less reserve during pregnancy, a woman can appear stable while still being at risk of deteriorating very quickly. Thanks for watching. See you in the next session. Bye for now.